Welcome again. In this video, I shall talk about the tremor syndromes. Tremor can be defined as rhythmic oscillation of body parts, and the following topics can be used to describe a tremor. First of all, the body part which is affected by tremor, whether it is the hand, the leg, or the face. And also it is important to mention its frequency in hertz, as 1 Hz equal to 1 cycle per second. Tremor less than 4 Hz is usually referred to as low frequency tremor, and more than 7 Hz it is called high frequency, and in between it is called mid frequency tremor. Third, we have to mention its amplitude, whether it is small or called fine tremor, large amplitude is called pulse tremor, or sometimes it is variable, referred to as jerky tremor. And finally, we have to mention the context at which a tremor occurs, whether it is at rest or action. Action tremor can involve the range of movement is called kinetic, or just the end of the movement called intensional tremor. So, in order to describe a tremor, we have to say that there is rhythmic oscillation, then to mention the body parts, followed by its frequency, then the amplitude, and finally the context at which the tremor occurs. Let's take an example. When we say that there is a 60-year-old male patient with a tremor, this carries a lot of differential diagnoses. While when we say that this 60-year-old male patient have rhythmic oscillation of his right hand, it is a 3 to 4 Hz, of course a tremor at rest, this will narrow the differential diagnosis to mainly Parkinson's disease tremor. Let's talk about each tremor with details. Tremor that occur at rest, the main cause is Parkinson's disease, and other causes can include Parkinson plus syndrome, vascular Parkinsonism, and drug-induced Parkinsonism. Drugs that block the dopamine receptors like antipsychotics and antiemetics, also calcium channel blockers, sodium valproate, and amiodarone all can cause resting tremor. The body part which is affected in resting tremor is usually the thumb and forefinger, which calls per-rolling tremor. Sometimes there is a flexion extension of the wrist or supination or pronation of the forearms. Other parts include the leg or the jaw. The frequency of this tremor is usually 4 to 6 Hz and its coarse amplitude. What about the tremor that occurs mainly on posture? Essential tremor is the most common cause, and also there is a dystonic tremor. Other causes could include physiological tremor, enhanced physiological tremors, and certain drugs like beta-2 agonists, thyroxine, antidepressant like tricyclic antidepressants, sodium valproate, cocaine, and amphetamine. Peripheral neuropathy like Charcot-Marie-Tooth. Body parts which is affected in tremor that occurs at posture, usually bilateral and almost symmetrical, involving the hand and forearm. Other parts include the head. Its frequency is usually 4 to 12 Hz and usually fine amplitude. And lastly, the tremor that is present mainly during movements, and its characteristic example is the intensional tremor, which characterizes cerebellar dysfunction and best to be examined by finger-nose test. Intentional tremor can be existed with rest and postural tremor. It's called rubral or Holmes tremor, and as the name refers, it indicates a lesion in the radionucleus or its connections. A similar tremor with significant worsening on holding hands front and deflection at elbow is characterizes the batwing tremor of Wilson disease. Examination of a tremor is by careful inspection of the hands of the patient at rest, looking for Parkinson's disease tremor. Then ask the patient to outstretch his hand, looking for essential tremor. Then ask the patient to outstretch his arms and flexion at the elbow looking for Wilson disease tremor, and finally ask the patient to do the finger nose test to detect cerebellar dysfunction. A special test for patients with essential tremor is by asking them to draw the Archimedes spirals, which tend to be irregular in essential tremor. Treatment of a tremor varies according to its underlying cause. As essential tremor, best to be treated with medication like propranolol, primidone, clonazepam, topiramate, and gabapentin. Parkinson's disease tremor is best to be treated with dopaminergic treatment and anticholinergics. Botulinum toxin can be used to treat dystonic tremor, and thalamotomy and deep brain stimulation can be used in refractory cases.